This video is going to be on the hip and the pelvis. Let's start with the palpatory anatomy of the piriformis muscle. That is a muscle that we know is somehow involved in many dysfunctions of this area. Where do we locate it? We can find it from the anterior side of the sacrum, going down outward to the greater trochanter, just as I'm showing you. My left hand is on the sacrum and the right hand is showing the direction of the piriformis muscle. As we can see, the patient jumps because it's a little bit contracted. This is a typical sign of the trigger point. It is very clear. And then we go on the belly of the muscle, of the piriformis muscle, and we find the trigger points here, right on the central spot with my thumb, because is where we usually find the thought bands and the trigger points. And then we will see the combination with the myofascial technique. Here we have a prone patient, we flex the knee and we use the lower limb as a leverage. We know that the piriformis muscle makes an external rotation of the hip. So what are we doing? We are doing a stretching and shortening as in a passive way. We place our thumb on the middle of the piriformis muscle and doing an internal and external rotation of the hip, we perform a myofascial technique. My left hand is doing the passive movements, whereas my right hand with the thumb is doing the myofascial technique on the piriformis muscle. We could also use another technique, ask the contraction of the piriformis muscle to our patient to move the leg towards the other leg, and then we can ask her to relax, and then we can do further compressions. Of course, this is the typical compression and relaxation of the muscle, so we use this to inhibit the muscle. Once we do the technique on the belly of the muscle, we move a little downward on the connection with the pyramidal or piriformis muscle. Many people know it as piriformis muscle mainly. And always doing an internal and external rotation, we can still do the myofascial technique where the piriformis muscle enters the greater trochanter. Sacrotuberous ligament. In the area of the hip and the pelvis, we have many ligaments. Now I'm showing you the sacrotuberous ligament. It is very important because it's connected with a very important neurological structure such as the sciatica, that we know it's involved in many problems and dysfunctions of the lower limbs and the spine. My left hand is touching the psoas, which is posterior superior iliac spine, whereas my right hand, the caudal hand, is touching the ischiatic tuberosity. And the movement is right. This one is a compression and a sort of splitting. We try to open. The right hand goes caudal and the left hand goes cranial, so opposite directions. So the right hand pushes towards the foot and the left hand towards the head. As you can see from the video, with the body, I'm right on top of the body of the patient. It is fundamental to use correct posture. Number one, to safeguard our own back, and second, because the maneuver itself is going to be more fluid and more effective. Sacrococcygeal ligament. This technique can be used in some dysfunctions where there have been traumas on the coccyx, and also not during the acute phase, of course. As you can see, I place my hand on the sacrum and I go a little bit down until I find a dimple. With the phalanx of the finger, I grab the coccyx. The coccyx and the sacrum are connected by ligaments that are the sacrum-coccygeal ligaments. By doing a little pressure on the sacrum, I push it a little bit anteriorly so to relax these ligaments. It is a very specific area, so we need to make sure the patient would let us do this treatment. Here we're going to see the treatment of the sacroiliac ligaments. We should be able to know how to locate the psis, which is the posterior superior iliac spine. We have the dimples here in our model, so we place our hands like this with the thenar eminence. We make a compression and we split the psis from the midline. So by pulling them apart, we are somehow working on the sacroiliac ligaments and we're performing a myofascial technique. It seems like it's not pleasant, but it is actually a very pleasant maneuver for the patient. Let's now see the techniques used for the pelvic floor. In these pictures, I'm going to show you how to find a reference point, that is the important one here, that we call ischial tuberosity. So I place my hand here, as you can see, and I palpate a bone that is called ischial tuberosity. Of course, in this case, I'm wearing a glove because the area is delicate. And what do? We move medially, so a little bit more central, and we find a soft structure that is the pelvic floor that is made up of different muscles. What did we ask to the patient? We actually asked the patient to make a small contraction, and the contraction was just if she had to hold the pee, because that's the first contraction that we can do in order to involve the pelvic floor. Once the muscles are relaxed, what do? I try to enter a little deeper, always very gently, and asking for a feedback from the patient. It is a very delicate area, so I ask for the contraction. Once the muscles have released a bit, I go a little bit deeper, but always gently, until the muscles relax. We can do this 3 or 4 times. What kind of muscles do we relax? All the muscles that make the pelvic floor. That's the muscle that we usually use when we go to the toilet.